Hello and welcome to Noor TV once more. This is Dr. Zaman Mobani coming in with our FICAP scrolls. Today I'll be discussing with you stress urinary incontinence and its management. Stress urinary incontinence is involuntary loss of urine with stress. What does stress mean? Stress means increased intra-abdominal pressure called Valsalva. What causes our intra-abdominal pressure to increase? Anytime we cough, we sneeze, we clear our throat, we use the contraction of our abdominal wall muscles to cause those activities to happen. And once that happens, what it does is that it actually essentially squeegees the bladder. And what should really happen during that time is the muscle around the urethra we refer to as compressor urethrae, some people call it the external urethral sphincter, should be tonically contracted to keep the urethra co-opted or closed up on itself, so the squeegeeing bladder from the increasing intra-abdominal pressure cannot let it open up and lose urine. When that process is in default, when you cough hard or sneeze or bend over hard, or even as simple as alighting from a chair or changing positions, which needs you to actually contract your abdominal muscles to have those activities done, you may leak urine involuntarily. If that is happening, it is called stress urinary incontinence. When stress urinary incontinence occurs with something as simple as movements, simple abdominal contractions that should not make it happen, you might have progressed to intrinsic sphincter deficiency. What does that mean? I mentioned the external urethral sphincter. It is a ring of muscle that helps to co-opt the urethra. Co-opting the urethra means keeping it tightly closed unless you are voluntarily relaxing it in a void in action or during urination. If that sphincteric muscle has lost its tone and is not able to actually contract, it's actually like a sling muscle to keep the urethra closed when that bladder is squeegeed from increasing intra-abdominal pressure during Valsalva, then stress incontinence occurs. So stress incontinence has a spectrum. And most women feel it with their first pregnancies when the developing and increasing uterus causes an increase in their intra-abdominal pressure. And there is a lot more squeegeeing pressure on the bladder that the uterus also tends to sit on during pregnancy. But most of the time after delivery, it goes away. And that's why when I mentioned getting our core strength strong, it's actually good to get your core strength strong before your first pregnancy, so that these things will revert back and snap back into normalcy after the baby is born. Following menopause and the exit of estrogen and the estrogenic effect to our external genitalia and internal gynecological organs, the muscles slack, they get softer, they lose their tone, and stress incontinence actually tends to be more paramount in those years. And women are actually unable to even perform activities like riding a bicycle or jumping up and down in a trampoline without really leaking. And they now default to putting on a pad every day to get about their everyday life. If that bothers you a lot and you're an active person and you're seeing you're going from smaller pads to bigger pads, it's time that you hear the good news. Stress incontinence is curable. What am I saying? It is actually the only form of incontinence that we can cure. Cure means that we can make it go bye-bye. So if you're having stress incontinence, come on over so we can evaluate it, confirm that's what you're having, and actually do the procedure that will tighten back that muscle that causes your urethra to stay closed no matter what the bladder is doing, unless you relax it by the process of micturition while in the bathroom. So the golden treatment for stress incontinence is a procedure called tension-free vaginal tape, which can either be done retropubically or transobturator route. And whichever one that we choose that is right for you, we hope to give you back your continence for a lifetime so you can go live your life happily and joyfully. So welcome to the world of no more leakage and no more stress when you cough, laugh, or sneeze here at Noah World. Thank you for listening, and I hope I'll see you at my next series. Bye-bye.